Two Fairview hospitals in the metro have been under federal investigation in recent months.
Both have been cited for violating the rights of patients who showed up in emergency rooms with mental health concerns. Fox 9 investigator Jeff Ballion tells us in one case, staff forcibly stripped a patient of her clothes.
A car pulls up to the emergency room of the University of Minnesota Medical Center at Fairview Riverside Hospital. A woman gets out whose medical history includes rape, bouts with anxiety, depression, drug abuse, and post-traumatic stress. On this day, according to federal records obtained by the Fox 9 investigators, she's acting paranoid, sounding delusional, but there's no evidence she's a danger to herself or others. She's taken to an exam room and asked to put on rust-colored scrubs like these. She sits calmly in a chair but refuses to change out of what she's wearing. A dozen staff members enter the room, wrestle her to the floor, strip her clothes off, and force her into the scrubs. When she begins to fight back, she's given a shot and sedated. The entire incident was recorded on video by the hospital.
How outrageous is this in your mind?
Oh, it's completely outrageous.
Roberta Opheim is the state of Minnesota's mental health ombudsman. Her office investigates complaints about mental health care. She's reviewed the records in this case.
I can feel the anxiety, the tension, just by reading those. It's completely outrageous to the dignity of the person that's there.
The U.S. Centers for Medicare and Medicaid Services investigated Fairview Riverside's handling of this incident. CMS cited the hospital for violating the patient's rights. Remember, this woman had previously been raped and then was subjected to having her clothes stripped from her by hospital staff because she didn't want to change into scrubs. The same investigation revealed staff used a show of force to coerce two other patients to change into so-called behavioral scrubs when they initially declined. CMS found the hospital had an ongoing practice of requiring anyone who came into the ER with a mental health issue to wear rust-colored scrubs that distinguish them from other patients.
Making anyone identify that they're a mental health or chemical dependency patient is a complete abrogation of the right to privacy.
This practice was not limited to the ER at Fairview Riverside. According to another CMS investigation, staff at Fairview's Southdale Hospital asked a patient who was brought in by police for a psych evaluation to put on behavioral scrubs. When she declined, 3 staff and 2 security guards entered the room and approached her.
They were going to disrobe me if I didn't put these scrubs on. I became very frightened because it was obviously meant it.
Teresa Graham eventually changed out of her street clothes. She was evaluated by a doctor and sent home. She later learned that a camera had secretly recorded everything that happened in the room. She obtained a copy of the video as part of a federal lawsuit she filed regarding her treatment by the police that night.
And so I realized that they had been filming the whole time. Including when I had to take my clothes off. I was just so horrified.
CMS cited Fairview Southdale for violating Graham's rights as a patient by recording her without her consent. The hospital had cameras installed in 3 psychiatric evaluation rooms with no signs alerting patients they were being recorded. In a statement to the Fox 9 investigators, Fairview says our goal is to provide safe and compassionate care to every patient while also ensuring the safety of our staff, providers, and other patients. Our pledge to this community is to continually learn and improve our care processes in order to best support the health and well-being of our community members. Fairview says the use of identifiable scrubs is a common practice in healthcare as a way to identify patients who pose a safety risk to themselves or others, but it's now making the use of them voluntary. Fairview continues to use cameras in some of its emergency exam rooms, saying it allows staff to continually observe a person to prevent harm to themselves or others. But there are now signs posted and patients are verbally informed of the cameras. They also must give consent to being recorded. I'm Fox 9 investigator Jeff Ballion.